Hello, I'm Dr. Nina Kim from the University of Washington. Interpreting hepatitis B serologies can be challenging for some clinicians. Hopefully after this session, you will have an easier time making sense of the different serologic profiles. In this talk, I will review the key structures of the virus, including the targets of serologic testing. We will also look at the evolution of these serum markers over the course of acute infection that goes on to resolution and clearance of the virus, as well as how they evolve in an individual who remains chronically infected. Understanding these targets and this evolution will go a long way in helping you understand and interpret the different serologic profiles related to hepatitis B. In the next set of slides, I've simplified the viral structure to highlight the key targets of serologic testing. Hepatitis B is a partially double-stranded DNA virus. Two key structures are the nucleocapsid core that is encased by the envelope. Hepatitis B surface antigen is our first serologic marker. It is a lipoprotein and component of the envelope and the major site of binding of neutralizing antibody. It is also the primary serologic marker of active infection, either acute or chronic. Hep B surface antigen can circulate as part of the virion or independently as viral particles. Either way, it can be measured directly in the blood. In addition to the surface antigen, the virus produces two nucleocapsid proteins, hepatitis B e antigen and core antigen. Hep B e antigen is secreted into the circulation, while the Hep B core antigen is assembled to form the viral core, which is then later packaged as part of the intact Hep B virion. For this reason, we're able to measure e antigen directly in blood, but unable to measure core antigen. So an individual who is exposed to the virus generally makes three types of antibodies in response to infection. Anti-HBs, or surface antibody, binds to the surface antigen in its various forms. This is our main marker of hepatitis B seroprotection. There is also antibody to e antigen and core antigen. In contrast to surface antibody, these antibodies do not confer lasting immunity. They basically indicate that this person has been exposed to the virus. We will not be talking further regarding e antibodies since this test is not used in diagnosis, but typically reserved for those who have chronic infection. For the purpose of this talk, we will be focusing on three main serologic markers: surface antigen, surface antibody, and core antibody. These three comprise a standard hepatitis B panel. This is really all you need to sort out someone's immune status and history of exposure to the virus. This figure shows what markers show up first with acute infection. Here in purple is the surface antigen. This is one of the first serologic markers to appear in a new acute infection and can be detected as early as 1 week or as late as 9 weeks with an average of 1 month after exposure to the virus. How long this sticks around can vary from person to person. Among recently infected persons who go on to clear the virus, about half will eventually test negative for surface antigen and Hep B viral level 7 weeks after symptoms. The core antibody here in pink is one of the first antibodies to show up in an individual infected by the virus. This remains detectable in the blood in the vast majority of individuals, indefinitely for the remainder of their lives. Here in gold is the surface antibody. This becomes detectable on a blood test after the disappearance of surface antigen in persons who are able to get rid of the virus and avoid a chronic infection. The presence of anti-HBs following a new infection generally indicates recovery, and a person is then protected or immune from reinfection with hepatitis B. In contrast, the person who becomes exposed to the virus and is unable to mount an effective immune response will continue to have lingering detection of the markers of active infection: hepatitis B surface antigen, HBV DNA, and e antigen. And while the core antibody eventually shows up in these patients, both as IgM and IgG initially, there is no sign of that gold line for surface antibody. Once you understand this evolution, you can distinguish various profiles based on the pattern of serologic markers. As a reminder, the best set of tests to sort out these profiles is the standard trio of surface antigen, core antibody, and surface antibody. Core IgM antibody and Hep B viral level and other tests are considered secondary diagnostic tests. I have included these here to underscore differences in a few of these profiles, but they are not always needed. For someone who is never infected or vaccinated, they should be negative for all of the serum markers. This is the individual who needs to get immunized. For someone who is acutely infected, we should see evidence of Hep B surface antigen and Hep B DNA in blood, as well as core IgM and total core antibody. Most of these individuals will not yet show evidence of surface antibody. For those who go on to clear their acute hepatitis B, we should eventually see lingering presence of core antibody and surface antibody, but all the other seromarkers of active infection, surface antigen, core IgM, and HBV DNA should be absent. Chronic infection, on the other hand, will have persistent hepatitis B surface antigen, and most of those not on therapy will have HBV DNA detected in blood. In contrast to our patient with resolved infection, they will not have surface antibody, but will have core antibody. The patient with isolated core antibody is typically someone who is waning of their surface antibody over time. Many of these individuals have seen the virus before and are effectively immune to HBV when exposed. A much smaller subset of isolated core antibody patients are those who have previously had chronic infection with a virus that evolves to lose its ability to produce surface antigen. These individuals with occult Hep B are distinguished from Hep B immune patients by the presence of HBV DNA. And finally, the individual who was immunized against hepatitis B should only have surface antibody and nothing else present in their blood. So that is hepatitis B serologies. There may be exceptions to these rules when you consider a patient who has a false positive, which occasionally happens, or in those who are transitioning from one phase to another, but for the vast majority of patients, they should fall into one of these categories. To learn more about hepatitis B, please check out our Hepatitis B online curriculum, which contains a variety of lessons, cases, and slides to reinforce your knowledge. Thanks for joining me today.
The production of this Hepatitis B online mini-lecture was supported by funding from the Centers for Disease Control and Prevention.